Good evening. The difference between the NHS in Scotland and England is growing ever wider, and a good thing too, say many Scottish doctors, nurses and politicians. While south of the border the coalition has pursued a hugely controversial and expensive set of reforms, here the SNP government have eschewed radical change. Some might say it's eschewed any sort of change. But is that necessarily good for patients? Couldn't Scotland borrow some ideas from our neighbours down south? And could a dose of private sector involvement and internal competition improve outcomes? Our health correspondent Eleanor Bradford joins me now. Eleanor, here in Scotland, amongst some at least, there's a temptation to look with horror at what is happening to the NHS in England. Are you suggesting that maybe we should be learning some examples from the English situation?
Well, there are some in Scotland who think that what we shouldn't be doing is standing still. Now, we like to pat ourselves on the back sometimes and say, oh, we've got a better education system, we've got a better health system. But is our health system really prepared for the train that is coming down the tracks, the challenge of an ageing population and financial constraints? It's generally accepted that in Scotland we do spend more on healthcare. Now, that's often explained away by a more difficult geography where it's more expensive to provide care over a larger rural area. Also, greater levels of deprivation, levels of poor health. But I've been doing some sums. And if you look at Trafford, for example, part of Greater Manchester, where the very first hospital to be built under the NHS was created, that is very different now to parts of the NHS in Scotland. It costs per person £1,450 to treat someone, give them healthcare for a year in Trafford. In Glasgow, the sum is very different. In Glasgow, it's £2,166 per person. Now, is there really such a difference between Trafford and Glasgow that explains how it can be a third cheaper to treat someone for a year in Trafford? People who are in favour of competition, whether that's competition within the NHS or competition by introducing private providers, say the cheaper costs in England are because of that competition.
Yeah, but there are other costs, aren't there? There's the costs of reform, at least in England.
There is costs connected with reform, and the Westminster government would freely admit this. They say that the reforms they're bringing in over the next year will cost around £1.4 billion. Most of that will go on redundancy packages for the present level of management who will have to go, plus you've got the IT costs and setup costs. But all that, they say, will be offset by the savings. They expect to make savings around £5 billion by 2015, and that's savings in staff costs alone. Now, devolution allows governments to arrange health policies that suit their own nations. But the ultimate question is whether these policies actually produce better services and better outcomes for patients. I've been looking at some of the changes in England and finding out what they have achieved. In Somerset, a service for people with chronic breathing problems is run by the private healthcare firm Bupa. Patients like Eddie Duffy get home care, drop-in clinics and help to manage their condition.
They have been superb. Nope, can't praise them enough. They've been wonderful. Before, if anything, I thought anything was wrong, we had to go to our doctor. He was fine, no problem. But by the time we'd gone to the doctor, he needed more medication. With the ladies, they monitor him on a regular basis, so they can stop something before it actually happens. They can warn us.
The service was set up by two local GPs who say their specialist nurses stop expensive emergency admissions.
It's gone very well. There were some teething troubles to start off with about setting up brand new services, of course, but we're very pleased with the way things went. It seems to be that the admission rate for COPD in Somerset seems to have levelled off, despite increasing ageing population and increasing number of patients registered with having the illness.
In England, more than 3 in every 100 operations is now carried out in the private sector. In Scotland, it's 3 in 1,000. And that's just hospital operations. It's estimated in England that £1 in every 20 of health spending is spent outside the NHS. In Scotland, that figure's not even recorded. Cornwall may share with Scotland a Celtic language and even aspirations of independence, but its NHS is a world away.
So we go and is in severe pain in her chest. Doesn't sound like it's cardiac or anything, but needs to be assessed.
Dr Louis Warren is one of 10 doctors on duty tonight with Cornwall's out-of-hours GP service, run by the healthcare multinational Serco. Here in Cornwall, private companies care for people with respiratory conditions and perform some routine operations. Even childcare services were put out to tender. In April, Virgin Care is due to take over the care of children like Josh Simmons. Born with cerebral palsy, he can't walk or see and depends on a raft of services such as physiotherapy and respite care. Josh's dad has reservations.
A bit of trepidation. I mean, it could be good. Ideally, we won't notice any difference apart from improvement. But Virgin are a commercial company, so they're going to want to make a profit, and do I want them making a profit out of my son?
In Scotland, there's long been a reluctance to introduce any kind of competition into the NHS. The Labour Liberal Democrat coalition made health boards bigger, not smaller, and encouraged collaboration. The SNP government continued that policy, discouraging any use of the private sector. Instead of reforming the NHS, it's reforming social care. Beth Butterfield is one of 5,000 people in Scotland to benefit this year. When she was first discharged from hospital, social services arranged for carers to visit her 3 or 4 times a day for as little as 15 minutes each time. She asked for the money for her care to be paid directly into her bank account, choosing instead to pay for a carer for a longer period once a day.
I didn't get out of a building in a year. I was in one room like a cell. Now I go outside, I talk to the neighbours. I even tried a tiny bit of gardening on a stool with the carer helping me, and we got covered in mud and it was great. And I felt like a normal human being. You know, it's a whole difference of approach. I feel I'm talking to somebody who is more of a friend than a carer. And that one's going.
Direct payments are due to become a right by law, and they're keenly supported by charities and the Scottish Government. They give patients the power to bypass the state and buy their care direct from private providers. But hang on, isn't that a system which the Scottish Government is fundamentally opposed to?
Well, the Health Secretary Alec Neil joins me now from our Edinburgh studio. Good evening, Mr Neil. Thank you for joining us this evening. Let's start, if we can, with Eleanor's final point there, which is why can that lady Beth be given a budget in order to purchase her home care, but she can't have almost any say in terms of her medical care?
Well, first of all, can I say there's a misinterpretation here of self-directed support. That's not about privatisation, or as you put it at the start of the programme, of promoting private companies in Scotland. Self-directed support is about promoting choice in social care, and my experience is that most of the companies that people who have self-directed support employ are actually non-profit making companies, companies like Enable, which is a fantastic charitable organisation that provides services to disabled people. So the idea that we're promoting privatisation in social care is just not true.
But I think the point being made actually wasn't that you're promoting privatisation, it was that you are promoting that choice, and that you are going to have increasingly a system in which people who have social care needs will be involved as partners in terms of dealing with that need. And so why, if that's the philosophy in social care, can't you also adopt that philosophy when it comes to medical care?
Well, we are doing, part of our agenda is going to be the integration of adult health and social care, and that will bring together the health treatments and the social care that adult people get, particularly our senior citizens and older people. And the whole idea will be that they'll, along with their GP and along with their other health supporters and social workers, will be able to take part in the decisions about what is the best package of care for them. So we are actually extending choice in relation to health and social care.
But you know, whoever controls the budget has greater power, and in terms of social care you're given your own budget, so why can't patients then also be given some control over their medical budget? And if you say that's something you're looking towards doing, then obviously they're going to spend that money on charities or on private providers or on whoever.
Well, in terms of the medical decisions, clearly they have to be informed by very expert and professional opinions, such as GPs or consultants. So the scope for just saying patient choice totally in the selection of medical...
No one's suggesting that, of course, are they? I mean, this would be a partnership approach, which, after all, is the argument for the direct payments scheme, isn't it? So why can't you have that in terms of medical care?
Well, that's what we're promoting, Raymond, in terms of the patient being involved with a GP or with consultants in deciding their future care. And one of the key things that we're keen to promote in the health service and in the social care system is more choice and patients being much more actively involved in deciding what's best for them.
So will patients who are seeking medical care, when you talk about greater active involvement, will they, for instance, be able to go to a private hospital for some of their care if they choose to do that as active participants, or will they just have to take the hospital that is given to them by the health service?
No, we're not going to be funding private hospitals in anything like that kind of scale, quite the opposite. We only use the private sector in very exceptional circumstances, and that's for very good reason. And that is, first of all, there's a very few private sector providers in Scotland relative to England anyway.
That's because you don't welcome them here,
but more importantly, actually, the level of care we can get in the National Health Service in Scotland is far superior to what can be provided in the private sector. Let me give you an example. The first decision I made as the new Health Secretary was for a new, what is called the TAVI Centre in Edinburgh, and that's an alternative to open heart surgery. Now, quite frankly, there is no way the private sector, I believe, could provide the standard of care for coronary patients that the health service provides. Indeed, if you look at what Dr. Barry Valence has said in the front of today's Herald, he has said the care in Scotland for heart patients is second to none in the United Kingdom.
You're a new Health Secretary. What's Alec Neil's big health idea?
I think the big health idea is our 2020 vision, that the kind of health service we're going to have in tomorrow's world will have to be very different from today's world, and that will be for a number of reasons. First of all, if you look at the traditional pattern of health in the past, when people went into hospital for relatively long stays, many of the procedures that maybe 20 years ago would have taken 10 days, 20 days in hospital can now be done by day surgery, and people want to be treated at home. Let me give you an example. NHS Lanarkshire, the National Health Board in Lanarkshire, has a first-class programme for treating patients at home who can be treated at home, and that they put in a package of support, which is both a care support package and a health support package, and that's far, far better than taking people to hospital unnecessarily.
Are there any lessons you think you can learn from the reforms in England?
Not a great deal. I think they actually learn from us, and what we're finding is that many of the practices in the health service in Scotland are of international renown. I'll just mention heart care being one example. Another example is the development of e-health, or sometimes called telehealth. Another example covered by the BBC the other day is digital medicine. In all these areas, Scotland is not just in the lead in the United Kingdom, we're actually in the lead in the world, and people are coming from overseas to see what we're doing in Scotland.
Let me just pick up on one story in tomorrow's papers. The Scottish Daily Mail reporting EU sinks SNP's alcohol plan. This is apparently the EU Commission telling you it's against EU treaties, your plans for minimum pricing. Is that true?
No, that's certainly not true. There have been objections from other countries. The EU Commission is looking at it, and we will have a certain time to respond to the observations made. Certainly, it is entirely news to me if they've ruled it out, and I think the Daily Mail perhaps has got this one wrong.
And very finally as well, doctors talking about industrial action because you won't cough up cash for their pensions. Are you going to avoid that?
Well, we're talking to the doctors, not just the doctors, but nurses and many others, because clearly these stupid reforms being implemented and forced on us by London do not make sense. The problem is, if we use public money in Scotland to pay for these additional contributions, that money is then going to be deducted from our budget from London, and that could seriously affect frontline services. So there is a major problem there. We're talking to the doctors, we'll continue to talk to them to try and find a way through this, as well as to the other health professionals who face a similar situation.
Health Secretary, thank you very much indeed for joining us this evening. With me now is Dr.